David Olsen?
It is. Thanks for having me.
I have two of David's written on my story here.
Actually, you're just getting one today. So David's actually, the other David's actually not in the office today.
Okay. It's not hard to confuse me. That's why I was worried about that. But this is David Olsen from Newsday calling in, and he's written a story about Nassau being ranked at number 2 and Suffolk the 16th among the healthiest counties in the state. Well, how did this come about?
Well, there's an annual study that the University of Wisconsin Health Population Institute and the Robert Wood Johnson Foundation, that's a health philanthropy that's based in Princeton, New Jersey. They conduct a study that's based upon some U.S. Census data, some federal Centers for Disease Control and Prevention data, and they try to measure two things, quote-unquote health outcomes, and that's where Nassau ranked number 2 and Suffolk 16th, and that looks at measures such as premature death rates and the quality of physical and mental health. And then there's something separate called health factors. Nassau was actually number 1 in the state for that, and Suffolk was 8th, and that looks at things such as smoking, obesity, exercise, pollution, along with statistics such as child poverty and educational attainment. So the idea is to give a sort of an overview as to, again, the outcomes are more, for example, premature death rates, and then the factors are behaviors such as smoking and obesity, as well as, I should say behaviors such as obesity, but activities such as smoking or exercise, as well as things like pollution and poverty.
Right. I'm not necessarily a student of, but I get a kick out of sometimes statistics, since I took it here at Nassau Community College many years ago.
So have I. I took mine last year.
Oh, yeah? Okay. Yeah. One of the things that I found really interesting here, the air pollution levels. Nassau has got a 10 and Suffolk's got a 9. That's the opposite of what, or healthy anyway.
No, exactly.
But it makes sense. I guess we're closer to the city. We probably, maybe we have, I guess, a bit more industry.
So I think it's a combination. It's industry and also, some pollution migrating from not only New York City, but as far as the Midwest, basically. And then you have, as you mentioned, there's some industry here, and there's also, for example, in colder weather, wood smoke from fireplaces, and obviously, most folks here get around by car, and so you have, fumes from exhaust fumes, and so there are a lot of factors that lead to that.
Right. Do you feel like the points that they use makes for a good statistical analysis?
I'm not a statistician, but right. they certainly seem to think so. I mean, these are obviously two very well respected. You have a top University of Wisconsin, and the Robert Wood Johnson Foundation, a very, very well respected foundation, and so you have two organizations with a very good reputation, right. So they obviously think these are good measurements of both health outcomes, general healthiness, both outcomes and also factors that lead to outcomes.
Right. Because that's the movable number, or the things you can play with the most are where you got your initial information,
right,
and then whoever reads you what they believe the answer to be.
Well, and also they obviously have to weight things and decide what's more important, and even every category, I guess some like smoking are obvious. Obviously, everyone knows smoking causes health issues, but you get into other sort of other types of things, like, for example, less direct. For example, poverty. Folks who grow up in poverty tend to have worse health outcomes and more health problems. There are so many issues, whether it's less nutrition because of less money to buy high quality food and things like that. So that's a little more indirect, but it's definitely, poverty, for example, is linked to poorer health outcomes, even though it's not as direct as, let's say, smoking.
Right. Although a lot of those things can be just intuitive. The idea that, if more people smoke, they have to be more unhealthy. And that might not necessarily be true. It's, you know what I mean? I mean, the population itself may not be less healthy, even though it may contain more smokers.
Well, that's possible, and I think it's. And I don't want to speak for how they weigh everything.
Yeah,
basically, but it's one of a number of factors, and and one of the interesting things is it also has to do with. I said at the beginning, access to health care is part of the access and quality of physical and mental health care is a factor in health outcomes, and that includes, for example, the access to primary care physicians, to mental health providers, to dentists, and there's more access in Nassau County than in Suffolk County. And an expert at Stony Brook told me one big reason for that is just the distance. For example, in Suffolk County, especially when you get further east, you have a longer distance. You have greater distances, obviously less density, and studies have shown that the longer you need to travel for care, the less likely you are to use it. So that's one reason Suffolk, one of a number of reasons Suffolk didn't fare as well as Nassau in some measurements at least.
Yeah. Wow. I don't know. I'm always up in the air about statistical analysis. I get, but it's just me. And it
is, and obviously there are different ways to conduct. Obviously there can be a totally different study that may use different measurements, and they may weigh things in a different sort of way. So maybe smoking would not be as important in that study than this one, or vice versa, or something like that. So there's probably no perfect way, because obviously there's no way to say as a fact this county is healthier than the other as an objective fact. It's a matter of obviously what sort of measurements you use and how you use those.
Right. And I guess that's it, depending on the measurements and things like that, that's how much trust we put in the answer, I guess.
Exactly.
Yeah.
And a lot of interesting factors. One of the sort of saddest sort of factors in a way, or disturbing, is Suffolk, both Nassau and Suffolk have had obviously problems with opioid addiction and opioid overdoses. But experts, I talked to my colleague David Schwartz. Talked to said that the fact that Suffolk has been hit harder by the opioid epidemic is a real factor in premature death, because remember, most folks who die of opioid overdoses are dying long before the median life expectancy. And so when you have people dying in their 20s and 30s, and you're talking about hundreds of people, obviously, every year, that's going to bring up the rate of premature death. So that's a key factor here for Suffolk, and it's sort of a sign of just the impact of the opioid epidemic.
Yeah, right. Interesting that but an event can skew that number significantly. Yeah. I mean, in my travels, I've heard that the statement that, people always ask what the leading cause of death is, and you hear, heart attack and cancer. Actually, as the answer, I heard medical intervention.
I didn't know that. That's possible. That may be true. Yeah,
right. So for them to use the ability to get to a hospital faster than everybody else as a flag for we are healthier, I don't know. Is that true?
Well, you could obviously argue that even though obviously I don't know all the statistics on medical intervention deaths, but obviously most people, if they have a serious medical problem, it's better to go to the hospital than not to.
Definitely. And I'm just, I'm a semi-professional muckraker, so of course I think of those things, but the article's good, and I don't know how that helps Nassau, other than, other people want to move here, I guess, if they, think they'll be healthier living in a place like that.
Yeah, although one of the things is, Nassau has a very high median income. So does Suffolk, though. Suffolk is a little bit below Nassau, but not by a whole lot. And so that's a big reason, because we were talking earlier about poverty. I talked to an expert at Northwell Health, who's, and other experts I've read over the years agree with this, that your level of healthiness is often linked to your median income, because folks who come from a family with more resources obviously has better access to health care, and there's a lot of other, for example, smoking rates are lower among people with higher incomes as well, and so high income is a major factor. And so, if you could obviously afford to move to Nassau, that's, I guess, the problem for everyone on Long Island is being able to afford to live here, but because that's linked so closely with health outcomes.
Oh, sure. And certainly the concentration of higher incomes makes for better health facilities. Even if you had a high income and you lived in the middle of the woods in Arkansas, you still got to get to a hospital before you can, exert your wealth by, you know what I mean?
Exactly. There's actually a fair number of high quality hospitals in Nassau, and there's not a huge distance generally that people have to drive to get to a hospital versus even some places in the eastern part of Suffolk, and certainly in some rural parts of the country.
Yep. Yeah. Well, wow. Okay, so we'll see if that helps us out. Being number 2, who's number 1?
Rockland
County.
My grandfather lives up there.
Mostly, I think it's a mix of suburban and maybe a bit of rural, but just north of the city. So that was number 1. It's also a place with a fairly high median income and had some some factors that it shares with Nassau County.
Nassau County. Huh. Wow, very interesting. Well, I thank you, David.
Well, thank you for your time. Thank you very much for inviting me.
Oh, anytime. And, please call in anytime you have a story. We'd love to talk to you.
Great. I appreciate that.
All right. And you have a good weekend. Take care.
Thanks. You too.
Thanks. Well, we want to thank David Olsen for calling us with the story, and we want to thank Newsday for making the reporters available to us.